Weight Watchers says it will now offer eligible members compounded semaglutide as part of its holistic weight management program.
We are at a crossroads here where we have millions of patients that qualify for this class of medication, yet many can either not afford it nor access it.
Dr. Todd Ellerin says sheer demand has created a market for compounded versions of popular weight loss drugs like Wegovy and Ozempic. The Weight Watchers website claims its compounded semaglutide has the same active ingredient in those name brands and is produced by an FDA-registered outsourcing facility. But Dr. Fatima Cody Stanford warns compounded versions of the drugs are not the same and they're not tested.
We have to recognize that they're not subject to the same rigorous testing and quality control standards of FDA drugs.
As 5 Investigates has reported, the FDA has issued a warning against compounded semaglutide, stating patients should be aware that some products sold as semaglutide may not contain the same active ingredient as FDA-approved semaglutide products like Ozempic and Wegovy, and that they have not been shown to be safe and effective. As of the end of August, the FDA received 346 reports of adverse events associated with compounded semaglutide.
We have seen a 20-fold rise in poisoning secondary to compounded medications specifically for weight management in this country. Why? Because there is not the same rigor. I would not subject my patients to this. There's variations in potency, purity, and overall quality, which can potentially affect the safety that patients experience.
Now, we reached out to Weight Watchers specifically about the safety of compounded semaglutide and have not heard back yet. Before you take any weight management medication, you should absolutely consult your own doctor. In the newsroom, I'm Mary Saladna, WCVB News Center 5.